Hi, my name is Hadi Zambarakji. What I would like to talk to you about today is cataract surgery and lens replacement surgery. So why do patients come and see us with cataract? First of all, what is a cataract? A cataract is clouding of the lens. So that's when the lens, which is supposed to be clear, starts to become more yellow, and therefore light going through the lens isn't getting through in the way it used to get through the lens, and the image that the patient sees starts to become hazy, or colors are not as clear, not as distinct. They look more washed out. Patients present normally because of reduced vision or symptoms such as halos, glare, halos at night, starbursts at night, sometimes headlight glare when they're driving, which is, as you all know, that are increasingly common. Playing sports become more difficult. Playing golf becomes more difficult. If you hit the ball, you can't see the ball up in the air, and so on. So you know, various different patients present in different ways. So that's for the majority of patients who have cataract. On the other hand, we also see patients who present at a relatively early stage in life, i.e. in their 50s, sometimes even earlier, with difficulties reading, and that's when they start to develop something called presbyopia. They're not able to see for close easily enough. And that's simply because the lens has become increasingly stiff and is not and doesn't move so easily, doesn't accommodate so easily. So near vision starts to become increasingly difficult. So this category of patients usually do not have much cataract because they are usually younger than the first category I spoke about. So two types of patients present for lens replacement: those that are younger and that have presbyopia, so difficulties reading, from the age of 45, 50, and those that are slightly older, in their 70s, usually 60s, 70s, that have proper cataract, i.e. the lens has started to become yellow, hazy, and the quality of vision starts to become affected. So we approach these two categories of patients slightly differently because the first category of patients who have proper cataract want improved vision as well as improved quality of vision, and then the issue of replacing the lens with a premium lens is discussed in clinic because premium lenses are the top lenses that we use to try and improve both distance and near vision. The first category of patients, on the other hand, are those that categorically are here because they want a lens that will give them both distance and near vision. So they're looking for that multifocality. Now, to keep it simple, the surgery itself is probably the same, although we need to bear in mind the eye itself, the limitations of the eye, i.e. if there are any conditions of the eye that might affect visual outcomes. And sometimes, for example, a patient may not be suitable for X or Y lens. So when we start talking about various different lens implants, we need to understand what is the actual visual potential and is that lens suitable for that particular patient. So there is no one size fits all. Briefly, these lens implants that we put in the eye at the time of cataract surgery are either monofocal lenses, i.e. fixed focus lenses, where you can decide to fix the patient's focus for distance or for near or intermediate, or trifocal or multifocal lenses, where you aim to improve distance vision and near vision. Personally, I have slightly come away from using trifocal lenses because there is a newer category of lenses that have come on the market called EDOF lenses. These lenses improve distance, intermediate, and near vision, but do not have much of the dreaded side effect profile of trifocal lenses. Trifocal lenses sometimes can cause halos and glare, problems with the bright lights at night, difficulties driving at night in some patients, and that can make them more or less suitable for everybody. For example, the patient that actually drives a lot at night may not be the ideal candidate because if they do get these symptoms, then that might affect what they do. For example, if they are a driver at night, if they drive for a living, for example. So we have to be careful about who to choose to put these lenses in. On the other hand, the EDOF lenses don't have this side effect profile and therefore may be more suitable to use. Patients ask me, what should they expect after cataract surgery? Because no one said this to me, or no one said that to me. So what to expect? You should expect the eye to be a little bit red, a bit sore, a bit uncomfortable. Not too bad, but it is not unusual for the eye to be a little bit uncomfortable. The vision does not improve straight away. Keep the eye clean. Put your drops in as prescribed. But most importantly, if you're going to, for example, take a shower, avoid direct water splashing into the eye. If you can, ideally have your hair washed by somebody backwards for the first day or two if possible, just to avoid water with soap going inside the eye. A lot of the do's and don'ts after cataract surgery are really about keeping the eye clean. A lot of it is common sense. Avoid heavy strenuous exercise. But the shield that we give the patient after surgery, for example, can be used just at night. During the day, just sunglasses, because especially initially, the first day or so, the pupil is still quite dilated, and therefore the light will probably feel quite bright on the eye. Otherwise, use your drops regularly, and if you have any questions, of course, always get back to us.